We've talked about that range. And by the sounds of it, for most people, if they're eating a whole food diet, they're going to have to up their salt intake. If somebody goes above and beyond, how does the body deal with that? Is there a safety mechanism in place?
It's a great question. So if someone is insulin sensitive and they're not salt sensitive, which is what I mean by that is salt sensitivity is sort of there's a wide range to how you define it. But basically, when you go from like a normal to a low amount of salt or a low to a high, somewhere between typically less than 1,500 milligrams of sodium on a low to somewhere between 3,000 milligrams or higher. If there's like a 3 to 5% increase in systolic blood pressure when you do that, you're considered salt sensitive, which salt sensitivity is really just a sign of insulin resistance, where you have elevated insulin levels causing you to over retain salt. So 80% of people with normal blood pressure are not salt sensitive. So the mechanism in place is your kidneys, where they can they filter 3.5 pounds of salt every single day. They're salt filtering machines. And there's been studies giving 100 grams of salt to individuals without high blood pressure. And there's no increases in blood pressure when they do that, because the kidneys are so good at basically getting rid of the excess salt and fluids. If you're someone who's insulin resistant, however, which is typically just because you're overeating refined carbs and sugar, so there's a fix to it. So basically, don't blame salt for what the sugar did. Those individuals will see a significant increase in blood pressure when they increase their salt and fluid intake. However, if they simply reduce the refined carbs and sugars or increase their intake of potassium or magnesium, that typically fixes the salt sensitivity 9 out of 10 times.
Okay. If somebody is insulin resistant and they start upping the salt after listening to this, is there a threat of damage, say to the kidneys, by having that increased salt? You mentioned the fact blood pressure could go up. Hopefully, whoever's listening to this will become insulin sensitive again. And you mentioned somebody who is healthy in that realm can have, you mentioned 100 grams of salt, and they were fine. But somebody who isn't, because most of us these days, I think the percentage is 90 plus, aren't sensitive to insulin. Do they have to worry if they hear this and they start including more electrolytes that they're damaging, say, their kidneys or any other parts of the body as they're upping the salt intake?
Basically, most of those individuals are probably eating a normal amount of salt. So if they start adding to that without reducing the carb intake, they're going to see significant increases in blood volume, which is going to put pressure on the kidneys, the heart. They can start seeing like what's called pitting edema, ankle swelling, essentially fluid retention. So you always want to have a strategy where if you have insulin resistance, you do want to start cutting back on the carbs before you start just like increasing your salt and fluid intake, because in those instances, and it's going to be a wide range, those individuals will probably see a significant increase in blood volume. The other downside, even if you're, let's say, not salt sensitive, if you start essentially eating we don't exactly know how much, but if you start going above 2.5 teaspoons of salt, it can cause a slight low-grade acidosis when you start over-consuming salt. So even though 100 grams of salt hasn't been shown in a few studies in people who don't have high blood pressure to increase high blood pressure, you will still get this somewhat low-grade acidosis if you start over-consuming salt, which is, we don't know exactly, somewhere between 6,000 and 12,000 milligrams of sodium can lead to a fairly significant acidosis, where bicarbonate levels will start dropping and you'll start spilling more calcium out in the urine because of this acidosis. So even in people who are salt sensitive, you do need to be a little bit careful from that perspective of going over 6,000 milligrams of sodium per day, which is essentially closer to 2.5 teaspoons of salt. If you start going above that, even if you're not salt sensitive, you can start increasing the acid load in the body.
So it sounds like using this salt sensitivity and insulin resistance, one could be a proxy for the other.
Yeah. If you're like, man, am I insulin sensitive or not? a good proxy for that is if you go from a low amount of salt to a normal to high amount of salt and you see a significant rise in systolic blood pressure of 3 to 5%, that's indicative of insulin resistance.
One of the biggest things you'll hear when people talk about salt in the lay population is a lot of people have been told by a medical professional that they have to moderate their salt intake because of the blood pressure piece. And what you're saying here, just to be crystal clear on this piece, that somebody who is insulin resistant, which again, I want to caveat that most people in today's world are, that can affect blood pressure. Mm-hmm. But if somebody isn't insulin resistant, the blood pressure piece, we can take that off the table?
Yes. And the thing is, too, is in those individuals that are basically, let's say you do get a reduction in blood pressure. If you are not volume overloaded, you're just volume depleting that person. So it may not even be a good reduction in blood pressure unless someone is volume overloaded. So when you increase potassium, that is a beneficial lowering of blood pressure. The arteries vasodilate, same with magnesium. But when you cut out salt, the blood pressure lowering may or may not actually be beneficial. If you are someone that has too much blood volume, then that drop in blood volume will be good. But if you're someone that has a normal blood volume and you drop salt intake and that drops their blood pressure, it may or may not be good because that could just be volume depleting someone and you're essentially just dehydrating them. So all blood pressure lowering effects aren't the same. Some can be good, some can actually be bad. In a lot of studies, when you cut salt intake to very low amounts, like less than 1,000 milligrams of sodium per day, it can actually lead to acute kidney failure because the blood volume drops so much and there's such a drop in blood flow feeding the kidneys, it leads to acute kidney failure. And I have a few references to that in the Salt Fix book. So you do need to be careful with just looking at blood pressure isn't always a good thing if it's dropping.
Let's take an example here. Somebody who is on a typical type diet, they're insulin resistant, they're having a lot of processed food, so they're getting a lot of salt in that food. They're going to transition to a lower carb, animal-based diet, the diet you recommend. How do they do that in a healthy way so they can balance their salt as they're making that transition?
You want to slowly decrease the carbs. You don't want to all of a sudden go from 400 grams of carbohydrates per day to now less than 40 because you're going to just tank your insulin level. You're just going to really start spilling out salt and you're going to really volume deplete that person. And so you got to be a little cautious. So I think a stepwise approach of somewhere around maybe 25% reduction in total carb intake for a week. And you do that every week until you get to your target goal of carbohydrates, which I think for the average person, somewhere between 50 and 150 grams of carbs is probably a good range. For most people, when you start going above 150 grams of carbohydrates, that typically is too much. Unless you are some type of like athlete that is exercising pretty vigorously every day, there's really no reason to go above like 150 grams of carbohydrates per day for an average person.
And for somebody that is overweight, insulin resistant right now, you mentioned that mid-range of carbs. Do you see value in temporarily at least really dropping those to lose that weight, regain metabolic flexibility in their metabolic health?
Yes, I do. I think for a lot of people, that initial 3-month period of maybe being less than 80 to 60 grams of carbohydrates, some people don't even consume any. But I do feel that after a year or two, if you are below 50 grams of carbs, I personally have seen more anecdotes of more issues than benefit. So I feel like even with myself, even with Paul Saladino, even with, Carnivore Aurelius, etc., after 1 or 2 years, the energy levels, particularly during explosive exercise activity, doesn't seem to be as good when you are on basically a very low or no carb. So I'm talking like less than 50 grams of carbs per day. I definitely notice decreases in exercise performance, but some people don't. Some people really do well eating no carbs. So I think it's kind of like trial and error where a subset of the population can actually be carnivore and for some reason they thrive. Whereas another subset like myself, and I have a more Mediterranean type of background. So like I would have had more exposure to fruits than let's say someone of Northern European descent. Because I'm Italian and I have, some descendantry in Calabria, which is southern Italy too. So my ancestors would have had much more access to fruits versus, let's say, someone, in Northern Europe. So I think honestly, genetics also plays a role in regards to who does well with like what type of carb intake.
I want to make sure I'm really clear on this piece. As somebody is transitioning to that lower carb, healthier whole food diet, because they're not going to get all that processed salt in the processed foods, and while their body's adjusting to this new way of eating, how would you supplement that diet as you're transitioning to that lower carb diet?
Yeah. Essentially, the first 1 to 2 days is like where you really see salt loss if you are going on a low carb diet. So if you cut your carb intake to less than 100 grams per day, essentially you need like an extra 1 to 2 grams of sodium for the next 1 to 2 days. So those are the most critical days. Then the next week, most people just need about an extra 500 milligrams of sodium to 1,000. It kind of depends on the person. In that first, if you get them through that first 1 to 2 weeks, making sure they're having a little bit of extra sodium or adding, a little bit of extra sodium, that seems to help a lot of people. So most people, when they're on that low carb diet, kind of tend to do better on the 4,000 to 5,000 milligram sodium range per day. Sometimes even 6,000 if they're exercising a lot, because of that salt flush for the first 1 to 2 weeks.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
I had started doing it 6 years ago, and I was scared to share it with my followers because I thought they would just say, oh, you're just saying this to push a supplement. So I never did. I haven't even talked about this until years after I published on this topic. Being on a high animal protein diet can